But we are, for all intents and purposes, sort of live, so
Live right now. Yeah.
be mindful of that. Be mindful of.
All right, we're live, Mayor.
Thank you, Steve, and welcome to the 16th edition of our virtual Mayor's Breakfast. I hope everybody's staying safe. I know the quality of air outdoors is pretty lousy right now, so be mindful of that. And another good reason to wear masks if you're outside, although Dr. Joseph might talk about what's the right mask to wear when you're outside in the smoke, which could be different than the mask you wear for the virus. Today, I'm really excited because we have joining us for the first time is John Malloy, who is our new superintendent of schools. Welcome, John, and I'll do a further introduction a little bit later on. In fact, what I'm going to do is I'm going to let Rachel Hurd, who's also joining us. Rachel has been on our school board since 2006, true educational leader here in the Valley. I'm going to let Rachel do your introduction because I want to make sure it's done properly. That's okay with you, Rachel? Good, thank you. And of course, Candace Andersen, our county supervisor here, and Dr. Joseph, who will do his presentation, a little slideshow at the end and give us the latest update on COVID. But for now, I'd like to introduce Steve Spedowfski, our deputy city manager, for any updates we have here in the city.
Thank you, Mayor. And as you mentioned, air quality has been very bad lately. And I just wanted to make sure that residents know and to check with the city website about the pools. If you have any scheduled time at the lap pools or tennis lessons, they were canceled yesterday due to the poor air quality. Some brief updates on some projects and proposals around the city. The City Walk approval by the Planning Commission about a week or two ago has been appealed, so that will be going to the City Council at an upcoming City Council meeting. A couple construction projects that you may see around town. So City Hall is in the process of being reconfigured. That's part of the public safety building agreement with the fire district. So you're going to see some construction equipment at City Hall. But once that's done, City Hall will be a one-stop shop for all resident permitting needs. We will have our permit center there along with our finance and other services to the residents, all located at City Hall. And also you may see some of the license plate reader cameras going up around town. So if you see people working on poles and installing little cameras on poles, that's part of the city license plate reader system that will alert PD if there's any wanted or suspect vehicles that enter the city. So that's it for the updates.
Thank you, Steve. Candace, thank you for being here every Friday that we do the mayor's conference. 16 weeks you've been here. I really appreciate your dedication, not just to this, but also for the work around the county. So what's the latest news that you can share with us on COVID?
Absolutely. And before I launch into COVID, I do want to do a shout out. Thanks to our firefighters who are doing such a tremendous job. All of our fire agencies in Contra Costa County are out there responding, a mutual aid, helping out in different parts of our county and throughout the state as we go through this incredible crisis. And as has been mentioned, and I'm sure will be throughout the day, yeah, stay indoors. It's just avoid all outdoor activities. But let's talk COVID right now and update some numbers. So 2 weeks ago, I always like to backtrack a little. We were at about 8,521 cases in Contra Costa County. We are now just over 12,000. We're at 12,046 cases in our county. So an increase of about 3,500 cases over the past 14 days, a little bit higher case count than we saw in the previous 14 days. And yesterday in Contra Costa County, we did see just an increase of 119 new cases. And that's with, though, a 14-day average of 208 cases. We have been doing a little less testing because of the poor air quality and also because of the heat earlier in the week. And so that has limited some of our outdoor test sites, but we are still having some data issues. As I mentioned at our last meeting, we hear from the state that they have fixed the entire CalReady system, but we still are concerned that we may be missing a little bit of a gap of some data from one of our major healthcare providers in the area. So either they were doing far fewer tests than we thought they were, or in fact, we're still missing a little data. So we have not yet posted our test positive case count. And that was something that's very critical. It's critical to getting us off the watch list. We need to be below 8% to get off the watch list. And so we're waiting for that. Right now, preliminarily, Dr. Farnatano was thinking we're probably hovering at about the 6% positive rate. But again, we don't have that definitively, and that's not up on our website yet. Virus is still spreading in San Ramon. 2 weeks ago, you were at 186 cases. You're now at 233 cases. So you've had 47 new cases in the last 2 weeks, a little bit more of a rapid rise than you saw previously. Good news, though, is that we are seeing a few positive things. One, we're not seeing as many, as I mentioned, we think as many positives, but we're also seeing a stabilization in our hospitalizations. We're not seeing the dramatic increase we saw the month of July. And so 2 weeks ago, we had a 7-day average of 102 people in the hospital. Now we're at a 7-day average of 97 people. And this morning, count was 93 people in the hospital. So not only are we stable, but we tend to see this decline. Again, keep in mind, back in early June, we only had 13 people in the hospital. So we did see a definite surge. Of those 93 patients in the hospital, 26 are occupying ICU beds, but our ICU beds are being occupied by many other people who are quite ill. So currently we have 42 of our 194 ICU beds throughout Contra Costa County available, which is just about 22%. And our real concern through all of this is the hospitalization, that yes, people can have COVID, they can have horrible symptoms, but we need to have the capacity within our hospitals to render the treatment that needs to be rendered so that we don't unnecessarily lose lives in a surge of cases. Now, we have continued to see deaths, of course, in Contra Costa County, and that's very typical when you see increased hospitalizations, because unfortunately, when someone is so ill that they need to be hospitalized, there's a stronger possibility, of course, that they would pass away. And so since we last met 2 weeks ago, we've had 30 more COVID deaths in our county. And we're continuing to see a shift that I mentioned last time I was here, and that we are seeing more deaths within the community than we are in long-term care facilities. Early on, it was about 70% of our deaths were coming from long-term care facilities. These last 2 weeks, 57% of the deaths were within the community, 43% were in long-term care facilities. And so that is a little bit of a disturbing trend. We are, of course, continuing to ramp up our efforts in long-term care facilities because that's our more vulnerable population. And we know that older people are the ones who are tending to pass away because of the impact of this illness on their probably in most cases a little bit more impacted health. But we are also seeing more younger people passing away, and this is another disconcerting trend. Now it's not surprising because we've seen such a huge increase in case count in that 18 to 40 age range. But in the last 2 weeks, we had one more person who was in that 31 to 40 year age group pass away. We had 4 people in the 41 to 50 age group pass away, 4 more people in the 51 to 60 age group pass away, 5 in the 61 to 70, and 16 who are over 70 years old. And so we are, again, it's still our older population that's passing away, but it is concerning because we are seeing younger people dying at a much higher rate than we previously had in the early days of the virus hitting our community. Still doing a lot of testing. We want to keep up that 200 per 100,000 where possible on a daily rate. We are still giving priority to those who are first responders, those who are symptomatic, those who believe that they've been exposed. And we're changing around some more of our testing. Our test site in Walnut Creek is being moved to the Ignacio Valley Library as of this Sunday to provide greater testing in the Walnut Creek area, which is an area where, interestingly, we see a gap. We aren't having as much testing there. We are also changing some of our testing out in West County, where we do see huge surges in cases, much higher than other parts of the county. And so we're ending our Kennedy High School run and we're moving it to a larger Richmond Civic Center is where it's going to be starting to take place on Wednesday, August 26th. And there the people can come in with or without appointments, and it's going to also add drive-through capacity as well. And of course, we watch carefully the new tests as they become available. We can't wait for the day where we can have the saliva test, the instant test, because that's really going to be the game changer for all of us when we know instantly who around us is ill, who needs to quarantine. That's really going to be helpful, and absent, of course, getting the effective vaccine. Continue with our contact tracing. We do now have over 200 contact tracers, which is really where we want it to be. But still, we're only able to contact about 54% of all cases are being contacted. And part of that is we're still seeing this lag in test data getting back to us with the positives. Over the last 2 weeks, the Board of Supervisors approved 4 more contracts for additional labs that can bring up our capacity. National Guard is helping us with a small set of our testing as well, because we know that's critical, and we're continuing to work on that. Good news is 95% of all of those who are identified as positive do have a place where they can self-isolate. We also do have hotel rooms. We have other places available. Should someone live in a home where there are many family members, they don't have a room to self-isolate, we have the ability to help them with that. But we have been, with all of this and with the data issues with CalReady that have really impacted our ability to see how we're doing, we have been sort of what I'm referring to as sort of a COVID doldrums. We're not really moving. We're just kind of stuck in the same place with as far as reopenings on the state's watch list. And it has been very challenging. But there is some reason for hope, because we are seeing these improvements with both the stable declining hospitalizations. We are able to start changing a few things, and one of which is earlier this week, we did announce that we are going to be opening up applications for elementary schools to get a waiver. Now, as long as we continue to be on the state's watch list, and until 14 days after we get off the watch list, schools cannot reopen for in-person instruction. And that would be our middle schools, our high schools. Elementary schools are in that category, but you are allowed to request a waiver. And so we're looking forward to having the review of those applications. And we do have a dashboard that's been added to our county health side that helps you track how we're doing with regard to being able to reopen our schools. So what some of the factors that have helped us move forward is just working really closely with the County Office of Education, with Lynn Mackey, with all of our school districts to really come up with a process that we hope will allow for the reopening of classes in our elementary schools in a very safe manner. Now, it's not an easy process to get a waiver, and it's not something that all schools are going to be able to readily comply with. There's a whole checklist that needs to take place. You need to involve your school districts with their parent groups. You need to involve the application going to the County Office of Education, then to County Health, and then if approved there, it will be brought onto the state. But some of the things that are required is a reopening plan website where families, where the district personnel can go to, cleaning and disinfection protocols, cohorting, how students are going to be kept in small, stable groups with fixed memberships, sort of what we've been doing with our camps, how people will enter and leave the schools, face coverings, other essential protective gear, health screenings for students and staff. And that's one of the more challenging ones, just because it's been so difficult to find labs to be able to do a prompt test turnaround. Health hygiene, ID and tracing of contacts, physical distancing, staff training, and going on to surveillance testing, which means testing people on a regular basis, whether or not there are symptoms. Triggers for switching to distance learning have to be laid out, communication plans. And so those things are not always easy to comply with. It probably will be easier for private schools to comply with all of these requirements because they're a much smaller group and parents are paying that additional fee. It's going to be a significant burden on school districts, especially a school district the size of ours, to try to meet all of those requirements. And there are some equity issues that have been raised by our state legislators who are concerned about, is it fair to allow private schools to move forward and when public schools can't? So a few other things that lies ahead. We are getting close. We hoped to have had a new health order coming out yesterday, but because of the air quality, our health officer did not want to encourage additional outdoor activities. If our air quality does improve, I think we will be able to anticipate in the next week or so opening up some of those outdoor activities that the state is already saying is allowed, such as personal services like nail salons. Still nothing touching the face, but personal services not involving the face and potentially outdoor gyms. Those are the things the health officer is poised to move forward with, absent an extreme change in circumstances and our numbers, but most importantly, a change in our air quality. So there is hope. We are moving forward. We're not stuck in the doldrums forever. And we're just, again, hoping to move forward as quickly as we can. So that is my report this morning, Bill.
Great. Candace, thank you for all the time you spend getting ready to present all that information to us in such a concise, quick period of time. So thank you.
You're welcome.
Next, I'm going to introduce Rachel Hurd. And since it's her first time on, I want to give a quick introduction. Rachel's been a long-term resident of the Valley here. She began working with, especially with youth, with the swim teams here in San Ramon and with the Boy Scouts, and a long history with that. When her children went to school, but very involved in PTA. And my hat's off, because you have been an absolute leader when it's come to reading and helping students master reading, especially those students like myself, who may have struggled at a young age. And hats off to you and everybody else who really focus, because if students can learn to read, they can master the world. That's really the key to success, is being able to read. So Rachel, thank you for that. She's also very involved in the Rotary, and is a past president of a Rotary Club here in San Ramon, and of course got elected to the trustees in 2006. So Rachel, thank you for joining us. I'll let you introduce our other guest.
Well, it is an honor to get to introduce Dr. John Malloy to the San Ramon Valley, particularly city of San Ramon. John comes to us from Toronto, Canada, where he led the largest school district in the whole country of Canada. I believe he had 22, maybe it was 23 board members on his board. And I mean, it's hard enough to corral 5 of us, but I can't even imagine the task it was to have a board that large. But he has been an educator for decades. His background comes in the counseling area. And I have already seen that incredible skill set at work as he's entered this, new environment, new country, new rules, new everything. And he's jumped right in. And all I have heard is positive feedback from people. And I feel the same way. So we are so lucky to have attracted him here to Danville, San Ramon. It's a long way to come, but I guess he has friends here, which is what drew him here. And we are truly lucky. So without further ado, John.
Much, Rachel, and it is an honor and privilege for me to be here with you. I'll just be brief on some background pieces that, Billy, you asked me to share, and then jump into what I know people are much more interested in related to our opening of school. But as Rachel said, I've spent the last number of years in Toronto. Prior to that, I was a teacher and a guidance counselor in Ohio. And I am really, really thrilled to be here for a number of reasons. One of the things that I knew from miles away about the San Ramon Valley Unified School District, because of reputation and I studied it, is high expectations for students, standards that are exemplary, but a real concern also about students' emotional well-being, and a commitment to equity, leaving no student behind. And that is loudly and clearly stated in all things San Ramon Valley Unified School District. It drew me, and I was so excited to be the candidate that the board chose. And it's been a month that I've been here, but prior to that month, Superintendent Rick Schmidt spent probably 10 hours a week with me on these types of calls. And when I landed on July 15th in this beautiful place, I felt like I was very, very up to speed. So I appreciate the hospitality. And the other thing I'll say before I jump into school business is I am so impressed that in the short time I've been here, I've been involved in discussions like this probably already about 5 times. And what I really appreciate about everything I'm learning is I may be involved in school business, obviously, and others that are on these calls leading other aspects of our work. But the great point is the issues come onto the table, we wrestle with them together, And we come up with better answers, better responses because of it. And I have found that in the course of a day, I probably spend at least a third of it engaging others who bring a different perspective, insight, and wisdom. And I think it's that dynamic that, again, makes me so excited to be here. So let me jump right into what we've been dealing with, what we've been working on, and what we'll be bringing to the Board of Trustees this Tuesday. I won't go into as much of the detail about the work we're going to do for Tuesday, because that meeting is happening at 7 o'clock on Tuesday, and everyone's invited to that. But I do want to really affirm the fact that throughout the month of July and into August, our families have been speaking to us in multitudes of ways regarding what it is that they hope is happening in our schools, what it is that they are wanting from us. And I am grateful for that, because what that says to me is how engaged our community is in public education. And that is so, so very important. The challenge we're facing, though, as we engage our families, is there are very, very diverse views regarding what it is we should be doing as we manage the COVID situation and as we support our students. It may appear sometimes that there's only one view, get back to school tomorrow, but I can attest, if you look at my inbox, that it's a bit more complicated than that. And so my job working with the board is to figure out what is it that we will and can do safely. And to that end, there was a clear expectation communicated by our families that if we needed to start the school year in a remote way, which we have, even though everybody did their very best in the spring, that it needed to be different, it needed to be better. And I want to say to the staff of the San Ramon Valley Unified School District, and I'm hoping, because I'm getting much more positive responses, though there are some challenges from our parents, a special thanks to how hard they have worked through the summer and on weekends to get this first week of school happening in a way that I believe meets more of the needs that our families have communicated, even though it isn't perfect. And to be honest, it will never be perfect, because it isn't face-to-face school. That's what we're made for, and we get that. But I will say that we are still growing, and so we are appreciating the feedback we're receiving. We are going to have a formal process for getting feedback from you. But at this point, we are staying very, very close to every situation. And what I ask of our families who are listening is, please rely on your teacher. Please connect with your principal if there's a question. And certainly, if there's an issue that you believe is a district challenge, by all means, our trustees are here, and Rachel will speak in a minute. And of course, the senior administration here at the District Education Center will also assist. But what we're finding is most of the issues that are emerging are ones that our teachers, our staff members, and our principals can certainly assist you with. Before I speak specifically about the waiver process, I'd like to communicate a couple of other commitments that we're really focusing on. Providing stability for our children in a time that's pretty unstable is a commitment we are working towards. And why I am saying that is because even though I know there are different views regarding what we should do next, part of what we're also paying attention to is we provide the most stable environment possible in these uncertain times, because our kids need it. Secondly, we want to provide the most effective learning opportunities that we can while we're in this remote space, and pay very close attention to what we might be able to do next in a safe way. All along trying to figure out how to be sure our kids are okay, because we're hearing that there's stresses and there's some anxieties and kids, and all of us really, I'm not going to just talk about students, we want to be together, and we're not able to be together in the way we normally are. And that is challenging, and we're trying to lean into that. I know that some of our community members might think that we aren't thinking outside the box or being creative enough in this situation. And I'm just saying that candidly, because we've heard some of that feedback from some. But let me share really directly that we are in this office where I'm doing this session with our face masks on, and the senior admin team is here, and we are trying to push every envelope to figure out what's the best way forward. And as I said, collaborating with many. We're also paying attention to who might need to return to campus sooner, even if we don't have a waiver, because we're waiting for guidance from the state. The governor announced a week ago that maybe following some of the childcare guidelines or guidance, that we could potentially bring some of our back to campus for small amounts of time to support them. Maybe some of our students with special education needs, some of our English language learners as a few examples. We are waiting for that guidance, and we will then engage our board, we will engage our staff. We are collaborating closely with our teachers and our other employee groups, and that's something that we're paying attention to. Safety of our students and our staff is key while we're doing all of this work. And to that end, we are paying very close attention to the checklist that Candace mentioned. We believe that as we examine it and as I collaborate with the other superintendents in the county, we meet every week. So sometimes I get the message to say, but all the other superintendents are doing the following things. I can tell you as of today, we were on the phone yesterday and Lynn Mackey, our county superintendent, is exceptionally responsive. We are all on the same page working this through together. And right now in the county, nobody is at a different spot in terms of a school district. As Candace mentioned, private schools might be in a different spot. But to be as candid as you'll come to find I always am, we can probably cover off most of the guidelines that are there. But the challenge that we're trying to figure out in order for us to provide the learning and keep our students safe is how do we deal with the testing and tracing piece? How much testing would be required in order for us to have the information that our students and our staff would be okay? And there's another piece to this puzzle that the waiver guidelines demand that we have a plan on when we would return to remote learning based upon the data of who might have been positive. That's the part where even though some families have said, I don't believe in all of this testing, and there are some views out there that maybe, you know, well, I'll just leave it to say that there are different views out there regarding what should happen. But as we read the guidelines, there's an expectation that the school district knows who may be positive, understands then how to proceed, and there are clear guidelines regarding when you close a class, when you close a school, and when you close the district. Well, you can't engage in any of that without the data. That's the piece, if I can say it very directly, we're still trying to figure out. My last comment before I turn it over to Rachel is going back to my stability piece. We understand, I just need everyone to hear it from me directly, that a 5-year-old sitting in front of their screen, no matter how brilliant the teacher is not an easy thing for the families who are trying to support that learning. And some families aren't in a situation where they can actually support the learning in that way due to their own commitments, such as work and such. And we do understand that, and we're trying to figure out how to actually be better with that. But if I go back to the stability piece, my last comment would be, one of the things that we're learning from other jurisdictions across North America, and again, I'm grateful that our data regarding our own COVID-19 situation is different than other parts of the country, but I am fortunate enough to be a part of a Californian superintendent group that I meet with once a week, and I'm also part of a national group. And one of the things we're all saying is the biggest worry we have about stability is if we had to move into returning, even though we're trying to be better in the remote, and for whatever reason, we can't remain there, and we have to go back out of the face-to-face instruction, and that is something that we're paying attention to as well. How do we ensure that when we open, we stay open? That is something that we believe is very, very important to our students. So Rachel, I will turn it over to you for additional comments, but I hope that answers, Bill, some of the questions that at least have crossed my desk in the last 2 weeks. Rachel, over to you.
Thank you, John.
And I don't really have a whole lot to add because, you know, most of this will be discussed publicly on Tuesday. I would like to thank all of our staff for stepping up. I mean, the amount of learning that happened in the last 2 weeks before school started was incredible. And then the decisions to go remote only had only happened 2 weeks before that. So this entire feat of shifting to rigorous remote only learning happened in a 4-week period. And that took a great deal of planning and a great deal of collaboration, and our employees in all regards really stepping up. And for the most part, what I am hearing as a board member is positive. I think people have had realistic expectations about those challenges and have been very pleasantly surprised at the quality of the learning and teaching that is happening with their kids. There, of course, have been people's concerns about how much screen time is involved. And we have some things to work out there about expectations, because some of the examples we're hearing are more extreme than the district intended. So that tells me just communication disconnect that needs to be cleared up. I would hope, though, that families out there do try to deal with concerns and conflicts at the lowest level and only escalate things as they go, because everybody is swamped with dealing with the problems John just described. And I worry sometimes that when we have people at John's level addressing problems that could be dealt with at a more site level, it takes away from him being able to do what he needs to do to make the decisions he was describing. But that concept of stability is really, really important. I worry a great deal about, we'll get everybody used to this current setup, then move to something hybrid, and then potentially have to go backwards, but not universally, and teacher changes, and the fact that not everyone wants their child to return to school. I mean, there's a lot of complexity here in trying to hit the happy medium of what people want. And all that change is a lot on the children as well as the adults. So, but I appreciate that the people have stepped up, and people are, for the most part, being patient and showing grace. I really think that's a big part of it. Showing grace in everyone, that this whole environment is stressful and scary and new. It's new every day. And we need to come at it with a mindset that we're all in it together.
Thank you, Rachel. Thank you, John. And I also want to thank John in particular for recognizing that there are families with young children who are struggling horribly trying to get these youngsters to deal with screen time and all the things that come with that. And I appreciate that you've recognized that, and those families know that you're very mindful of the battle they're fighting at home, and that you're trying to figure out, the board are trying to figure out ways to get kids back to school safely. So thank you for recognizing that. It's my pleasure now, and of course you guys will be here because we'll have some questions after Dr. Joseph finishes here, but I'd like to turn back to Dr. Joseph, who has been so grateful. I mean, we're so grateful that you spend the time with us every 2 weeks to give us an update. So Dr. Joseph, what do you have for us this week?
Well, thank you, Mr. Mayor. Before I share my screen with some slides, I think it's just so important to address the heroes of today. And throughout this epidemic, they have changed. I must reinforce, or at least agree with Supervisor Andersen. We have to thank the firefighters who are out there right now, this minute, risking their lives. And then the tough part right now are the education professionals. We're all dealing with that. I think it overshadows the medicine right now, because both of those are what we're dealing with on an hour-by-hour basis. So let me thank all of you for what you are doing. Steve, I'm going to share the screen now, and we'll try to make it work. Is it sharing?
We see just Zoom.
We see your Zoom. When you share, can you click the PowerPoint?
It is clicked. We'll try it again. There we are.
Correct.
That's satisfactory?
Yep.
That's much better.
Great. Well, I'm only going to talk about these two things. Just a word about the Russian vaccine and what we know about it so far. And I'm going to spend the rest of the time talking about masks and what we know, and try to clarify some of the things based on the questions that I have been getting. This is the only comment I'm going to make about the Russian vaccine, because we know so little. We understand that there were 76 researchers who vaccinated themselves in May. One of them was President Putin's daughter, who is involved with research. It is described by them as safe, effective, and sustained. But again, this was just May through August. They are now doing the typical phase 3 studies. of safety and efficacy. So those have not been completed yet in Russia, but their plan is to immunize or vaccinate healthcare workers starting this month and introduce it to the public in Russia this fall. The vaccine has been approved as a drug by Russia's Ministry of Health. The response from professionals around the world has been mixed. There have been some criticisms, there have been some applause, but everyone is hopeful that this product will work. This is not an ego situation. We all want to see an effective and safe vaccine. Now, I was going to put this slide at the end, but I'm going to show it twice. It is concise. It is the answer. It addresses so much, and it was published this month by the Association of Medical Colleges. 3 big points. Wear a well-fitted but comfortable face covering and minimize the gaps around the nose, the chin, and the cheeks. If cotton is being worn, at least 2 layers is recommended. That's not 2 different masks, but a mask made of 2 layers of cotton. Indoors, always. When around persons from another household or another bubble, always, regardless of the distance. The air current inside can be stagnant. The virus can live longer. So indoors, always, when around someone from another household, and outdoors only when you're less than 6 feet apart, even if it's for a few minutes. So if you're passing someone on a sidewalk, you want to wear a mask, but more than 6 feet apart, it's not necessary. 3 simple rules. If we all follow these, we've got it made. Masking is our only effective force right now to control this virus. We don't have anything else, and yet it's very, very simple. Now, I will say that there are some regulations that are more strict that have been published by, or at least put out by the county health officers or state. We have to follow the rules of our own community, but this is what's coming down nationally, and it's very, very concise, very good. So I showed this slide before, but it caused me to go back and read more about it. All of these were pictures taken in the United States. This was the 1918 influenza epidemic that went on for 2 years, infected 500 million people. The number of deaths is unclear, but probably about 25 million. 500 million people were infected. We are now worldwide at about 23 million. This virus was seasonal, and the COVID is not. So there were times when the virus was at a lower level in the United States, then it would come back. Remember, influenza is seasonal, coronavirus is not. But it did go on for 2 years, resulting in about 50 million people that died. Now, the other important thing is that it's so analogous to what we're looking at right now. And I had to go back and look at this. There was not a national mask mandate, but rather masking was local. San Francisco insisted on masking, but Oakland did not. There were some states where the governors insisted on masking and some states where the governors said you don't need it. There were counties where masking was required. There were counties where it was not. So it's almost identical to the local rules that we are seeing going on right now. So why do we wear a mask? So I've divided these into 2 sides of the slide. On the left side is what we do in a hospital. There is a N95, and everybody has heard this word. A fitted N95 is a picture of what we're looking at there. Fitted means that when I put on this mask, I have to go into a room and use chemicals to be sure that nothing goes around the outside of that mask. It is fitted to me. And there's several products, and I will pick the product that fits the shape of my face the best. And this is what a provider wears when face-to-face treating an individual in the hospital or treating a person who is infected. This protects the wearer. This filters inhaled air. The surgeon's mask is below it, and the surgeon's mask is completely different, and it filters exhaled air. Now, it looks like a lot of masks that you see people wearing on the street, but it is not. This is specifically designed to filter exhaled air. You can see that it ties around the back. It doesn't have ear loops. So in order for it to tie around the back and not slip, it requires a surgeon to wear a surgeon's cap. This is 2 layers of paper with a polyester filter between it, all designed, and it has specific specifications to filter exhaled air so that what is in the nose and throat of a surgeon doesn't enter an open wound. Now, the CDC defines a big difference between mask and face covering. That's just not going to fly. We use the term mask colloquially, we use it in public, so we're just going to have to talk about all of this being masks. In the community, masks or face covering are defined to protect others in case one is unknowingly shedding coronavirus. And in contrast with the surgeon's mask over here that has specifications that must be met, these are variable. And they variably filter exhaled air. And that's where we're going to be. We're not going to get to a point where we're demanding specifications. We want people to be comfortable. Variable filtration is just fine. So I'm going to talk a lot about this today and what we know so far. Now, the term has come up repeatedly is what is the difference between an N95 and a KN95? And the N95 is on the left. This is fitted. This is what I've talked about before. It's designed for a caregiver to protect a patient. The KN95 is similar in its filtration ability, but it is not fitted. This is something that you can buy commercially. There will be air leaks around the outside, around the cheeks, around the chin, around the nose. So this doesn't work in a hospital. It has ear loops rather than ties, and it's loosely fit, and it's kind of comfortable. If you like it, it's fine, but it is no better than fitted cotton, and I'll show you a little bit about that in a moment. But I use these when I'm out in public because it's comfortable and people give them to me. But a KN95, although the filtration capacity is the same, it is not fitted and it's not acceptable in a hospital. And similarly, the difference between a surgeon's mask and the ones that you would buy commercially, they look the same. But the surgeon's mask has very specific criteria for filtration. The ones on the right are very good products. We want to see people wearing these, but they have no specifications whatsoever. And usually they arrive in a bundle, as you can see in that picture on the right, that there's no description of what they do, but they're fine. It's a good product. They are disposable. They're inexpensive now. These were the ones that were very hard to get in February and March. They're widely available. And I encourage you to use these if you like it, a KN95 or any of the other products. Now, speaking of the other face covering or masks that are in public, there was one study done at Duke that attempted to compare several products that could be commercially prepared. So going from the left, the fitted N95 that I would wear in an intensive care unit is the first one on the lower left. And the y-axis is the number of droplets that come through a mask. So obviously the ones in the hospital, the expensive ones, the ones that are designed with specific filtration capacities are the best. And you can see that almost no particles gets through a fitted N95. A fitted N95 protects me from a patient. It also protects a patient from me. Very expensive, very difficult to use because fitting is required. And then what they did at Duke is they just purchased a bunch of things across across the bandana and fleece. This shows the amount of droplets that are expressed. Let me go back up. This shows the number of droplets that are expressed if you don't wear a mask, and fleece is actually worse. than a mask. And I know what fleece is, but I wanted to go back and look at it a little bit so I could discuss it. This is fleece. Fleece is a brushed cotton or a brushed polyester. But the important part is that it's brushed, and it's brushed so that it's soft and warm and comfortable, but brushing loosens up the fabric and almost makes it like a screen. So there is essentially no filtration of a fleece face covering. It's something we do not recommend and do not want to use. Now, in contrast, when the Duke study came out and said that bandanas were bad, there was a lot of pushback. And I've titled this slide, All Bandanas Were Not Created Equal. The one on the left is the typical bandana. It is from India. It's a combination of silk and cotton. It's colorful, it's often paisley, and it is not recommended. But the ones on the right are also called bandanas, but they're made of double layered cotton, and they are very good. So we have to be cautious. What I think we see down here on the left-hand side, the typical bandanas that have been around for centuries, these are not recommended. They're just not that good. But anything that is double layer cotton and recommended, like a neck gaiter, as we see here or here, these are pretty good. So just because they are called a bandana does not mean they're bad. And a comment about face shields. Some have asked me, is a face shield a satisfactory substitute for a mask? And the answer is no. There's specific uses for a face shield. We cannot recommend them to replace a mask. In a hospital, it's common to wear a face shield and a mask because it really protects the caregiver, the provider, from splashes, from getting material into the eyes. Masks don't do that. Rarely, coronavirus is spread by acquiring it through the eyes, but it's uncommon. It's the nose and mouth that represent the source of infection. But if somebody's coughing or spitting, a mask can be helpful. So it's very good for first responders in selected situations, but not to replace a mask. And remember, if we look at the slide over here, we wear a face covering or a mask to protect those around us. There's absolutely no information that wearing a face shield protects others around us. So it is not to be used for that. It is used to protect the wearer in a very few selected situations. So what doesn't work? This is what you don't want to see. On the left side are valves with masks. After a lot of CDC discussion, we finally changed the CDC recommendation that does come out and say, do not wear a mask with a valve. What happens, as you can see this is KN95 fabric, so excellent filtration, inhaling, but the mask has no filter at all. So since we are wearing masks or face coverings in public to protect those around us, this completely negates the situation. The valves are exhaling, are open during exhalation and putting virus into the air. These are really made for industrial situations, and you can see what this person is doing. Wearing a mask to prevent the inhalation of particulate matter, of dust, of sawdust, of shavings, of metal, then you don't want a barrier to exhalation. So masks with valves should be avoided during this current epidemic and reserved for industrial use. And then on the right, I tried to show an analogy of what you see if you wear a mask below your nose. It's just like a diaper that's not worn correctly. It's not going to work. What we see here is an individual wearing a mask below the nose. And this is probably one of the more common errors that I see as I walk down the street. Remember, this virus is exhaled from the mouth and from the nose. A face covering or a mask of any kind needs to cover both the mouth and the nose. And here is the good new finding. This just came out at the end of last month, just a few weeks ago. A wonderful study that shows any face covering that we wear, any mask that we wear, also partially protects us. We have been saying what we do in science for the last 5 months, that a mask is an exhalation filter. A face covering is an exhalation filter, and we wear it to protect those around us, to show them that we care. Now we find that that same filter does partially protect us. Not completely, not as good as what I would wear in a hospital, not as good as what a care provider would wear, but it does partially protect us. In some elegant studies using these paper masks that can be purchased commercially, using double layer cotton that can be made or purchased, partially protects us. So remember what I said. Right now, we don't have a vaccine. We don't have a medication. Masking or face covering represents our best weapon against this virus. I get asked all the time, do I favor universal masking? Absolutely, I do. It's not a requirement, but I truly favor universal masking until we get a better weapon against this virus. So it partially protects the wearer and definitely protects the individuals around the wearer. So I told you I would show you this slide twice. It's simple, it's concise, it's what we need to do. Wear a well-fitted, comfortable face covering, minimize the gaps around the side if you can. And if it's cotton, 2 layers. It doesn't get any better than that in the community. This will stop the spread of this virus. Indoors, always, if you're around persons from another household, even if you're across the room from them, and outdoors, it's not necessary from the medical side unless you're closer than 6 feet. And I know that some counties, Alameda County and Contra Costa County may have different recommendations. I can't keep them all straight. I recommend that we do follow the guidelines of the public health officer in our county. But these are now the consensus guidelines. And if we follow these are simple. If we follow these, we will control this epidemic. We will stop new cases, or at least drop them by 80%. That's all it takes. We really, really need to do this. And so the last slide, many excellent studies show universal masking significantly lowers transmission. We all need to do it. Wear a mask, show others that you care. Wear a mask, show them that now you can say, I'm smart, I'm partially protecting myself. And Mr. Mayor, with that, I will stop, and we have time left, and I will let you decide what to do.
Mayor, you're on mute.
Thank you. I tried not to interrupt in the middle. Steve, I'm going to turn back to you to see if we have questions in the time remaining for our guests.
Yes, we have several questions. The first one for Supervisor Andersen: do you believe Contra Costa County can get off the state's watch list by September? And if so, will you allow small businesses, in particular professional, personal services, to reopen?
Wouldn't that be great? And unfortunately, my crystal ball is still really foggy with regard to whether we can be off the watch list by September. I think if everyone heeds the doctor's advice and wears a mask, I think we have a much better chance of doing so. My goal is to open businesses as quickly as we can. We've opened most small businesses except for some of our personal services. And so even with us on the watch list, I'm hopeful once our air quality improves, we will be able to open even more small businesses outdoors. That's critical. And then it is just a matter of continuing to work to stop the spread. And again, it's out of our control because it's really so much of the public's control of what you choose to do with regard to gathering. Avoid those in-person gatherings. And if you have to have an in-person gathering, wear a mask, do it outdoors. Those are really simple things that can really help us. We did it before when we flattened the curve. We're having to try it all over again.
All right, next question is for the school district. Is there any estimate as to when school board meetings will resume in person?
Rachel, do you want to take that one?
And I think, again, it's about mitigating risk. And so if it's working or working well enough to hold the public meetings as we're holding them, it makes sense for everyone involved to continue doing that. Making them in person, the size of the room is only so big. And so if people were having to come into the room, be 6 feet apart, be masked as they participate, having all of us masked as we participate, I think sometimes we forget that returning to normal is a different normal. And we really need to look at what is the most important piece of that environment to drive your decisions. And it's really hard to listen to people talk when you can't see their mouths. And so I often feel like we're better off in this public setting to continue to meet through Zoom than we would be to all be in the same room with our masks on and a camera 20 or 30 or 40 feet away, where you'd just be seeing little heads, and most of the people would be viewing it online anyway. John, you can welcome to add to that.
I think you covered exactly what I would have said. And I think that until I got here, I didn't realize from a distance how small our boardroom actually is. And the small number of staff, usually with the president, who are in the room, 6 feet apart, we actually fill the space. So I think that's important to know if you haven't been to our boardroom.
I know for us as a city council, I'm sure for Candace, it's very frustrating not to have in-person meetings because the communications are richer when you see people face to face. If there's a silver lining to it, perhaps, and I think the school boards experience this, is that we're having far more participation in our Zoom meetings. We're having far more people watch these and get involved in our meetings than we did before. And I'll look to Rachel. I think one of your meetings had how many people involved in terms of watching and those who were able to participate?
I think the last, those meetings in July where we discussed how we were going to reopen school had in the thousands, maybe not continuous watching, but I heard 5,000, I heard 7,000. I mean, it was, a high interest topic. I've even noticed as a board member sitting on the Zoom side, because sometimes 1 or 2 board members will be in the boardroom just because their conductivity at home has been kind of sketchy. It's hard because we don't see them at the same size as that we see the others. And we've all gotten a lot more used to looking at this Brady Bunch screen and getting the feedback that way. And when you don't have that, you miss out. I do miss being able to see the audience. It's really hard to just talk to a camera and not get the feedback that you get when you're talking to a room. But if the room was only, a handful of people, I think we miss out on the whole point of a public meeting.
And Mayor, we between YouTube and Zoom for the Mayor's Breakfast, we average about 100 live viewers each time. And I don't think we could fit that many people into Clementine.
No,
so,
no.
Yeah, it's definitely benefited these broadcasts. For Dr. Joseph, and you were explaining your chart about the materials for the masks and the types. Unfortunately, you did cut out for just a brief second on the chart. So there is a question related to that. I wanted to make sure that it was clear. It's from somebody who wears a neck gaiter at work, so the full neck covering, not a bandana, and reading about studies that the gaiters might make it worse because the mesh breaks up the particulate matter, and then the finer particulates get out and are suspended in air longer. So would that be mostly related to the style of mask, or is it the material? Because some of them are made of cloth, but then others are like a polycloth blend.
Thank you. It's not the neck gaiter or the style of the covering, but rather the material. We're finding out that the most reliable material is woven cotton. Tightly woven cotton is the best, and 2 layers. So it really doesn't make any difference if it's a mask with ear loops, if it's a neck gaiter. But really, we need to avoid polyester if possible. Definitely avoiding fleece. But there are many cotton neck gaiters out there that are just fantastic. There are neck gaiters out there that are fleece and should be avoided. So it's the fabric, not the style.
And,
Okay,
and
and also-
Steve,
Oh, yeah.
Steve, I say, and given the time, I was going to ask Dr. Joseph, since he was talking, there's also some studies being done and tests to give instantaneous results on whether or not somebody has COVID. Could you give us an update on what is the status of instantaneous tests?
Instantaneous tests are frequently called antigen tests. And it is not PCR that we've talked about so many, many times. The problem with an antigen test is that it's only useful in high prevalence circumstances. It's not good for what we're seeing right now with a very low number of people being positive. A negative antigen test has to be followed up with a PCR test. So if we tested 100 people in San Ramon, we might find 5 or 6 or 7 who are positive, but all of the other 95 or so would have to be followed with a PCR. So what we want right now, since testing will solve the problem, instant testing, we want a rapid test, a 5-minute test that will give us a reliable negative. We're not there. Supervisor Andersen mentioned the saliva test, and there are 2 now that have FDA authorization. One was developed at Rutgers, which I know very well. One was developed at Yale. They're both PCR tests, but they do have the time limitation of doing the PCR laboratory component. So they're not rapid tests, they're just convenient.
Great, thank you.
All right, another question, and for Supervisor Andersen, do we know how many small businesses have closed permanently because of the pandemic lockdown?
No, I don't have that data, and it's a tragedy that has come with this pandemic, and it's something where, from the county standpoint, one of the small ways we tried to help mitigate it was by putting the moratorium on evictions, moratorium on rent increases for small businesses, and we really grappled with it. Initially, we thought we don't want homeless people being kicked out of their apartments, but we expanded it to small businesses as well. Totally understand how frustrating and challenging it is in a pandemic of this nature. And so much of it is, it's health driven and balancing those two. So, but I do not have that exact number. We will be, after the fact, working with our chambers, working with other groups, because we have seen so many businesses need to close down, just given the circumstances.
And also to add to that, putting on my economic development director hat, in speaking with many of the businesses, they have been surviving on some of the loan programs and some of the state and county assistance. And it is projected, at least from what I'm hearing, fall, winter will be the real trial for them once assistance starts running out. And in particular for some of the restaurants, when outdoor dining will become far more difficult. So I think we're going to have to wait to see on the true impact. It's a little bit delayed, but yeah, unfortunately there might be a bigger hit to come. For the school district, we had a question of how many laptops, iPads, hotspots have you distributed to district families?
Thanks for that question. The last I have been briefed, we were up around 7,000 devices. In terms of the hotspots, we were up at around 1,200, but that still is, some days we get more requests, and we've tried to respond to every request that we've been given. And the latest one we've been working on, because there were some concerns around chargers. So if anyone's listening who needs the charger, if that's required, please contact the email or the phone number we've given you, and we're looking after that now as well.
Great. Dr. Joseph, there's a question regarding a comment that you made several broadcasts ago about sewage testing as a way for early detection of COVID-19. And the question specifically is, are you aware of any of this being conducted in Bay Area communities?
No, good question, but not in the Bay Area. The CDC, the Center for Disease Control and Prevention, has launched a campaign doing sewage testing at certain hotspots around the country, but the Bay Area is not included. I don't know if the State Department of Public Health will want to do this. Currently, it's United States Public Health Service that's doing it at scattered areas around the country. But it's taking off, and it's still very, very good. A great way to define a community that is at risk.
All right, and another question for Dr. Joseph. In March, CDC guidelines for hand sanitizers discouraged the use of sanitizers with benzalkonium chloride as an active ingredient instead of alcohol. Have there been any recent studies that BC can be effective against COVID?
Well, benzalkonium chloride is a quaternary ammonium, and it is effective, but it doesn't last very long, and it takes a lot more contact time than alcohol. The main reason that it was not recommended, it was being promoted as the sole active product, and it takes about 30 seconds of rubbing your hands with a quaternary ammonium to control the virus. There have been some products that come out that include that and other enzymes that are now being studied. So right now, the recommendation for a hand sanitizer is any of two alcohols or either of two alcohols. That's ethyl alcohol or isopropyl alcohol, with the same recommendation to avoid methanol or methyl alcohol.
Okay, another question. What changes has the school district made to improve distance learning this fall versus spring?
I'll start, and Rachel, certainly from your perspective, please add. As Rachel mentioned, our staff has been working for the last number of weeks to ensure that they understand all aspects of the tools that we've provided. We have listened to what it is that they have been wishing for. We haven't been able to provide everything, but in terms of resources that are much more conducive in a remote space, we have focused the number of tools we're using. One of the complaints that we in the spring were that there were so many sign-ins and so many different platforms. So we have focused on the Google Classroom, and we are also using Zoom that connects in that for the older grades, grades 3 to 12. And of course, Seesaw is the tool we're using for the younger students. The reason I mention that is because that focus has assisted things. The other collaboration that took place with our unions was standards that we would follow. Our board was able to approve those as well. So though, as I said earlier, we're not trying to replicate face-to-face learning because that's just not healthy. And as Rachel mentioned earlier, we're still trying to adjust how our expectations are being interpreted so that students are not in front of a screen from morning until late afternoon. But we actually have been very clear about the amount of time that teachers and students would be together in real time, and then how some of the assignments and learning opportunities could happen beyond that. And another piece that's shifted is in the spring, when we didn't really know what we were dealing with, when this pandemic came on fast, when we didn't know how long it would last, decisions were made around grading that may have made some students not as motivated to participate, or not knowing exactly how this was going to feel like school. We're much clearer now about assignments are being marked, grades count. Again, we're trying to balance the social emotional piece, but I think those are some of the pieces that I would suggest. Rachel, is there anything that you would add that I may have missed because I wasn't here in the spring?
I think the one thing I would add on to that is about attendance being taken throughout the day, beginning and end in elementary and by class in the secondary levels. And so that's adding another layer of accountability too.
Right, I think we have time for one more.
One more, go ahead.
And for Dr. Joseph, what are you hearing about treatment of infected patients? Are there any effective treatments that are being used widely today? And also, I know you spoke about blood plasma treatment earlier, and apparently the FDA is putting that on hold for some reason. I don't know if you have any comments about that.
Yes, on both. There are well over 80 clinical trials investigating drugs. None of those trials yet have come to fruition. So the treatment that we've discussed before is still the same. Since the seriousness of the disease, now let me say the first part. The first part is the mild disease, that is those individuals who are not hospitalized, there is no treatment at all. It is supportive care and self-isolation. For those who are hospitalized, who have underlying respiratory disease or in an intensive care unit, that's usually due to an overactive, uncontrolled immune system. And so the treatment for that is to back down the immune system, usually with immunomodulators, corticosteroids, various other drugs that are available to block the immune system. And then the one drug that has been approved is remdesivir, which is an antiviral. I did mention plasma. I still am a big proponent of that. I will say this, that there have been about 7 or 8 studies that show a definite beneficial effect. But for the FDA to approve something, it has to be a particular kind of a study. So all persons in my situation are optimistic, but it has not, and we're using it. This does not mean it can't be used. So it's being used in our community, in our local hospitals in Contra Costa County. It's very good, but it has to meet a certain level of testing before the FDA can put the stamp on it. But it is available, it is being used, and those studies are going. It's only on hold because it just hasn't quite met that level.
Great. I want to thank all our guests. John, welcome aboard. We look forward to many long years of service here in the Valley. Rachel, we appreciate your many long years of service here in the Valley and look forward to many more to come. And thank you for being here this morning. Candace, thank you. We look forward to, if you invite you again 2 weeks from now, if you can come by again and give us an update. We're looking forward to hearing all those positive new things occurring, hopefully here in the county. Dr. Joseph, as always, your guidance and your advice has been helpful to schools, organizations, businesses, and to citizens to have a sense of what they can do to keep themselves safe. It's incalculable how you've given a lot of people peace of mind and good habits to form to keep us safe. So thank you so much. We appreciate that.
Thank you.
And Steve, as always, for quarterbacking this and putting this together, thank you. And to all the residents, stay safe, wear your masks, follow the rules of Dr. Joseph, and let's really keep our thoughts to all the firefighters battling the fires, and also to all the children who are struggling with learning, distance learning, and to thank you to the teachers who help them navigate that path. Have a great weekend. Stay safe. Take care.